హలో నర్సెస్, వెల్కమ్ బ్యాక్ ఫ్రెండ్స్. ఇంపార్టెంట్ MCQస్ని వీడియోలో మనం డిస్కస్ చేద్దాం. ఫస్ట్ క్వశ్చన్ ఏంటంటే లీస్ట్ లైక్లీ ఫిజియలాజికల్ చేంజ్ ఇన్ ప్రెగ్నెన్సీ. ఆప్షన్ ఏ ఇంక్రీజ్ ఇన్ ఇంట్రావాస్క్యులర్ వాల్యూమ్, ఆప్షన్ బి ఇంక్రీజ్ ఇన్ కార్డియాక్ అవుట్పుట్, ఆప్షన్ సి ఇంక్రీజ్ ఇన్ స్ట్రోక్ వాల్యూమ్, ఆప్షన్ డి increase in peripheral vascular resistance. Friends, the correct option is option D, increase in peripheral vascular resistance. Next question, maternal physiological changes. Option A increase cardiac output, option B increase tidal volume, option C increase vital capacity, option D decrease fibrinogen, option E decrease plasma protein concentration. Friends, the correct options are option A, B and E. Maternal physiological changes increase cardiac output, tidal volume, at the same time decrease plasma protein concentration. Next, abnormal cardiovascular change in pregnancy. Option A enlarged cardiac silhouette, option B increased S1 split, option C right axis deviation on ECG, option D early diastolic murmur, option E HR increased by 10 to 15 per minute. Friends, the correct options are option C and option D. Next, physiological cardiovascular change in last trimester. Option A mid diastolic murmur, option B occasional atrial fibrillation, option C shift of apical pulse to left fourth ICS, and option D cardiomegaly. Friends, the correct option is option C, shift of apical pulse laterally and upwards in left fourth intercostal space. Next question, normal pregnancy findings except option A decrease serum iron, option B increase iron binding capacity, option C increase blood viscosity, option D increase oxygen carrying capacity. Next question, which of the following is increased in pregnancy? Option A globulin, option B fibrinogen, option C uric acid, option D leukocytes, option E transferrin. Friends, the correct option is option A, B, D and E. A globulin, B fibrinogen, D leukocytes, E transferrin. Next, true about pregnancy changes. Option A increased fibrinogen, increased uric acid, decreased serum potassium, option D sodium retention. Friends, the correct options are A, B and D. A is increased fibrinogen, B increased uric acid, option D sodium retention. Next question, physiological changes of pregnancy include option A insulin levels increase, option B increased BMR, option C hypothyroidism, option D GH decreases, option E blood volume decreases. Friends, the correct options are option A and option B. A increased insulin, B increased BMR. Next question, insulin resistance in pregnancy is because of option A human placental lactogen, option B thyroid hormone, option C progesterone, option D HCG, option E estrogen. Friends, the correct option is option A HPL human placental lactogen. Next question, most common cause of decreased platelets or thrombocytopenia in pregnancy. Option A immune, option B incidental, option C idiopathic, option D infection, option E benign gestational. Friends, the correct option is option B, incidental. Next question. During fetal life, maximum growth is caused by option A, GH అంటే growth hormone, option B, insulin, option C, cortisol, option D, thyroxine. Friends, the correct option is option B, insulin. So during fetal life, maximum growth insulin వల్ల జరుగుతుంది. Next question. Following hormones secreted by placenta exclusively. Option A, HCG, option B, estrogen, option C, HPL, option D, PRL. Friends, the correct options are option A and option C, HCG and HPL. So placenta exclusive hormones. Next question. HCG is secreted by option A, trophoblast cells, option B, amniotic membrane, option C, fetal yolk sac, option D, hypothalamus. Friends, the correct option is option A, trophoblast. So HCG is secreted by trophoblast. Next question. False statement regarding HCG is option A, it is secreted by cytotrophoblast, option B, it acts on same receptor as LH, option C, it has lutotrophic action, option D, it is a glycoprotein. Friends, the correct option is option A, it is secreted by cytotrophoblast. Next question. Regarding HCG, true is or option A, glycoprotein, option B, has 2 subunits, option C, increases to maximum in 3rd trimester, option D, secreted by trophoblast, option E, alpha subunit is specific. Friends, the correct options are A, B and D. Next. Regarding HCG is secreted from option A, placenta, option B, pancreas, option C, lung, option D, liver, option E, breast. Friends, the correct option is option A, placenta. HCG is secreted from placenta. Next question. In normal pregnancy, character of vagina is or vaginal changes. Option A, increased pH, option B, increased number of lactobacilli, option C, increased glycogen content, option D, increased number of pathogenic bacteria. The correct options are option B and C, increased lactobacilli and increased glycogen. Next question. Risk of thromboembolism increased due to. So in normal pregnancy, option A, increased progesterone level, option B, increased production of clotting factors by liver, option C, changes in blood viscosity, option D, increased antithrombin 3. The correct option is option B, increased clotting factors. Next. All of the following statements are true except option A, oxytocin sensitivity increase in labor, option B, prostaglandins may be given for including abortion during 3rd trimester, option C, general stimulation increased oxytocin, option D, oxytocin used for 1st trimester abortion. Correct option is option D. Last question. Hormone responsible for decidual reaction and areas stellar reaction in ectopic pregnancy is ఆప్షన్ ఏ ఈస్ట్రోజన్, ఆప్షన్ బి ప్రొజెస్ట్రాన్, ఆప్షన్ సి హెచ్సిజి, ఆప్షన్ డి హెచ్పిఎల్. ఫ్రెండ్స్, ద కరెక్ట్ ఆప్షన్ ఈజ్ ఆప్షన్ బి ప్రొజెస్ట్రాన్. ఫ్రెండ్స్, ఫర్దర్ ఇంపార్టెంట్ వీడియోస్ కోసం మన ఛానల్ని సబ్స్క్రైబ్ చేసుకోండి. కాంపిటేటివ్ ఎగ్జామ్స్కి ప్రిపేర్ అవుతున్న వాళ్ళకి షేర్ చేసి హెల్ప్ చేయండి. థ్యాంక్ యూ.